Welcome back to Wellness Wednesday on All Sides. I'm your host, Ann Fisher. When a patient gets a serious medical diagnosis, it can be confusing and scary. Patients are expected to deal with complex terms, decide on treatment options, and consider what will be covered by health insurance, all while dealing with a health issue. The issues are getting more complex at the same time that physicians and nurses seem to have less time to spend one-on-one with each patient. A new specialist is emerging to help with that. It's called the Patient Advocate. Joining us now is patient advocate and owner of Guided Patient Services, Dr. Annette Ticoras. Welcome to the show.
Oh, hello. It's good to be here.
You're only one in the state of Ohio, as far as you know.
I do know there's another in northeastern Ohio.
Okay.
But for central Ohio, as far as I know, just me.
Why so few?
It's a new entity. I think back in the 90s, large hospital facilities were instituting navigators, especially in the areas of oncology, just to help facilitate treatment and to answer questions for patients and to keep them somewhat engaged and empowered. And then I think that as it's become more and more complex, people have reached out to family and loved ones to kind of act as that role of advocate.
Like go with me to my doctor's appointments kind of a thing.
Mm-hmm.
Yeah. Particularly with serious illness, particularly with oncology, it's gotten really complicated. I mean, in a good way when it comes to treating, but in a bad way when it comes to understanding.
Right, because the options are just so diverse and so complex, and the words are impossible to pronounce, the treatments likewise, and people want the best of care. They want all of the options available to them to be explained to them, but then they need to do that all very quickly.
You know, having to hire somebody like you to do this rubs some people the wrong way. It's extra money and insurance doesn't cover it.
Right, and it's something that I deal with. I field many calls during the week of people who cannot afford services or to pay to have this done. And I often do get those conversations, why am I paying to do what healthcare is supposed to do for me? And in many cases it does, but there are those exceptions, and those are the calls that I receive.
You are a physician, a licensed physician.
I am.
What made you take this change?
I took some time off when I raised my children, and in filling that time, this was what I found I was doing, whether it was by choice or not.
Just friends calling you for help?
Friends and family. We have an upcoming appointment, or this is what the doctor said, or this is the new prescription I've been written for. These are my symptoms. What do you think? So I was finding I was doing this, and then I had a series of friends who had breast cancer, many within a 1-year period of time, and was down here in Columbus at that time assisting, and found that there was a need. There was an overwhelming need, and knew that when I re-entered medicine, it was going to be in a different capacity. And this was a perfect fit.
There's only one other patient advocate that you know of in the state. There's a couple hundred across the country. What are their backgrounds? Do you talk to each other and who do they tend to be? People like you, a physician, or what?
No, it's very diverse. I have had quite a bit of contact over the last, I'd say, 3 to 4 years. Those that I tend to have the most in common with, that we seek each other out professionally, would be nurses. A couple other physicians are doing this as well. Social workers do this. I, on occasion, have utilized someone who's more in the financial insurance realm. Maybe they were a biller or a coder for a physician. That is not my area of expertise. I stay out of that lane. So sometimes I will refer to them or consult them regarding questions I have.
Are there standards of care when it comes to being an advocate like this, a patient advocate like this?
Today, no. As of the date today. There is a task force that has been put together by the national agencies and memberships for advocates that are putting together a certification exam. And it will then be required to pass that exam, to have some credentialing. So moving forward, when someone says they are a credentialed or accredited or certified advocate, it actually has some bearing and some meaning that is consistent across the board.
When you look at a future in healthcare, how do you envision this role actually working in the most efficient, effective way?
Well, I have a dream of how that looks. And for me, I've had the opportunity to be in hospitals working side by side with my colleagues, physicians, but in a different capacity. And I think the more exposure that the healthcare system has to this, the more that everyone will realize it's such a win-win-win situation.
To just do it themselves?
Not necessarily do it themselves, but to maybe have to broaden their support staff in their offices to accommodate the needs. Right now, resources are so tight in a physician's office with all of the charting and medical record and phone calls, and now physicians are being asked to email and text, and I can't imagine how long the days have become. That if some of those tasks could be diverted to other experienced personnel, I think they would find their job would be easier, and the patients would be, in some cases, better satisfied.
You said a win-win. Win-win for who? Who are the vested interests in that equation?
For a patient, they now are getting maybe that explanation 2, 3, 4 times that may be needed. Someone's slowing the situation down. Someone's willing to go beyond that office appointment for additional questions they have later, and to be able to field those questions, take those calls, almost translate what just happened. For a physician, there's a benefit there. I've had multiple opportunities where I've been in a hospital and a physician has roughly 1 to 3 minutes to round on a hospital patient. They may do that twice a day, but it's very brief. And patients have compiled a list of questions.
Because they're told to.
Yeah, be ready, be prepared.
Mm-hmm.
And they have to advocate on their behalf. And sometimes that's very, very difficult, especially with the elderly population. When you sense, and they read people's body language, if you sense your physician is at the edge of the end of the bed with the hand on the door, and you've got your list of 4 questions, it's kind of an intimidating situation. So I think that if physicians would then allow a knowledgeable person, whether it be a patient advocate or a family member who is knowledgeable, to be able to speak for that individual and to enter into that kind of a relationship, it really pays off. Also in the hospital, there are so many physicians coming in and out. The communication tends to not be the best always. And again, an advocate can step in and kind of bring all those pieces together and make certain they're working collaboratively.
I guess, who should be providing that, though? You said that, I mean, and who should pay for it? It's a person. It's a human being doing this job. Mm-hmm. Should it be covered by insurance, do you think?
I don't think that it should be something that an individual is slated with paying for. Where those funds and where those resources are going to come from, I don't see. I don't see where that's going to come from. Mm-hmm. To involve insurance in one more capacity of healthcare, I'm not sure that's the route to go. I don't have it. To be honest, I don't have an answer, but we need some.
And I'm just wondering who's harmed most by all of this will tend to be somebody who doesn't have a lot of disposable income.
Exactly.
They're going to tend to come from less education background, less time, more stress, more toxic stress, that kind of a thing.
Mm-hmm. But I have many clients who are on the other end of the spectrum, and to be in the healthcare system today is...
By definition, toxic stress.
I didn't say that, you did. Unless you have a medical degree, I'm not really sure how you would navigate today's healthcare. There are so many people coming in and out of an office, in a room. You're not certain what role each person plays. The orderly looks the same as the physician, looks the same as the specialist or the person who's going to wheel you down to radiology. And so people, I think, tend to just sort of lay back and let whatever's supposed to happen, and assume that the best of care will be provided to them. And in most cases, I do believe that it is. But there are lots of opportunities to step in and make certain.
How well or how could this be mitigated at the educational level when it comes to medical professionals, physicians, nurses, nurse practitioners, all that kind of stuff?
Well, I've had several people reach out to me. There, for a time being, I would say maybe 5 years ago, there were a lot of institutions that were affiliated with medical schools that were trying to incorporate a certification coursework, and they were actually trying to put some of the medical students through at least some of the coursework so that they were aware of it. They could do it on their patient's behalf or know that it was a vital part to include in their practice. A lot of those have gone by the wayside. And what popped up in place is a lot of online certification exams to kind of, brush over and give some very superficial knowledge to people. I know that I've heard, OU and some of the other medical schools who are trying to do a more patient-centered education are very open-minded to reaching out that, we realize that, that thing, it's going to take a village. It's going to take a village to really, in healthcare now, to provide for a patient. I think it's going to take more than the physician.
Are there any liability issues that someone like you has to grapple with? Are you insured?
I am. I carry professional liability insurance and am absolutely, positively very clear with all of my clients and is all my information. I do not provide services. I don't treat patients. I don't provide any kind of diagnostic assistance or...
Is what you do give advice? Do you put it that way, or how do you describe what you do in the simplest terms?
I try not to use the word advice because that's what they should be getting from their physician. I translate, I incorporate, I digest it, I process it for them, I lay it out in a way that makes sense to them and ensure that they truly understand so that they're empowered enough to make, I don't make their decisions, I empower them to make decisions for themselves. But they can keep coming back. But I still don't, they can say, I still don't understand that. I want some more information. Or are you sure there's nothing else that I could be doing? Some of my clients are just that. I'm very comfortable with my physicians, but I want to make certain that there's nothing else out there that I should be looking into. And in that case, I'm tasked with doing the research to see what else might be available.
Finding another opinion, that kind of a thing. Because we were just talking to Susanna Meadows, the author of that book, The Other Side of Impossible, Ordinary People Who Face Daunting Medical Challenges and Refuse to Give Up. And I would think there's a role there in terms of helping people who are not getting satisfaction from the traditional community and helping them find other options.
I can, assist them in finding other options, or sometimes the first place I start and the one that makes the most sense is to just try and address the current help and healthcare that they're receiving. Does the provider just need to slow down and listen? Does the patient really get their points across, and have they made their case clear to the physician? So many times, I think in almost all times, the circumstances show that communication could be improved. And so I try and go in first and improve the communication with what's already in place. Get a good feel that what's in place does need to be tweaked or changed or improved. Often that fixes a vast number of the concerns that a client has.
Who often hires you? Is it the person who is sick, who's getting the medical treatment themselves, or sometimes is it their family members?
Both.
Okay.
And I'm set up to do it in both ways. I think the one caveat, though, if a family member would approach me about caring for a spouse or for a parent, provided that the parent is of sound mind, everything needs to be signed for and agreed to by that parent. I can't, just like a physician, they can't step in and start to take over for the individual. However, in the circumstances where medical power of attorney has been executed, then I start to work with the medical power of attorney, but of course insist upon seeing that the documentation is up to date and appropriate.
I would imagine an aging population boom that we're in now is going to have a lot of call for this sort of thing, whether it's somebody helping people who are hard of hearing and that kind of thing deal with medical issues.
Yes, I think with our aging population, a lot of them, their plan that they had in place was, I'll be there for you, you'll be there for me. And so I think those who are widowed, those who maybe were divorced earlier in life or perhaps never married, and the coined term, and I don't know if it's been on your show before, is an elder orphan. And that term is being used a lot.
It has no children.
Have no children. They either have no siblings, or in any of those cases, if they have one or some of that family available, but they're estranged from them, that still essentially makes you an orphan. So these people know if they've kind of slowed down and taken time to think about it, that they're facing, or the risk of facing, a healthcare crisis on their own. And that's a very scary place to be. And I hear that a lot. I've planned for my funeral. I've planned for this. I've planned for that. But if the rescue ever takes me to the hospital, there's no one on the other end, and there's no one I can call, and there's no one who's going to show up. And that's a very, very disheartening thought to have day in and day out.
Have you ever been called by a physician to step in?
No, I'd love to. I'd love to.
Where they understand what their limitations are and say, I need help.
I think we're headed there. And, people have asked me that multiple times. I've had absolutely nothing but positive reception by the medical field. I still, again, consider myself a colleague and have the utmost respect, but we each can play a role. And I think once they see it in action and see how not taking Mrs. Jones's 20th call that week, and then the one from her son and the one from her daughter, and she still didn't fill the prescription. But let me have a shot at it. Let her have a relationship with me. Let me have the opportunity for her to feel as though it's slowed down and her questions are addressed and explained in a way in which she can understand, and it empowers her. So then she does what the healthcare field wants her to do, and she's healthier and benefits.
Do you get involved at the palliative care hospice level too?
Again, I think it's a great fit and it's a great place. Thus far, only because I've had clients come to me who are at that stage.
Right. Okay. Well, Dr. Annette Ticoras, thank you so much for joining us. I appreciate your time today.
Thank you very much for having me.
Dr. Annette Ticoras, she's the owner and advocate at Guided Patient Services, Inc. She's the only one in Central Ohio for sure, only one of two in Ohio. We'll have a link to her website on our website at wosu.org/allsides. That's it for Wellness Wednesday today. Thanks a lot for listening. This is All Sides with Ann Fisher on 89.7 NPR News.